Hi, I'm Dr. Monica Peek, and I'm a professor of medicine at the University of Chicago. I think there are a lot of things that drive racial disparities in breast cancer mortality for Black women and compared to white women. I think one of the major things has to do with structural inequalities in access to care, in the quality of care, in the way that women are treated once they're in the healthcare system. And these negative experiences are shared not by only by the women who experience them, but by the entire community. When women return to their communities, full of fear and troubled experiences, then those circulate within the community. And other women who may not have breast cancer, but may go on later in their lives to have breast cancer, then become afraid. Should they get a diagnosis? Should they get an abnormal mammogram, a stage, a class 4, BIRAD 4 mammogram? That what will that mean if they have to enter the healthcare system? They also are wondering what will that mean as far as their ability to take care of themselves and their family, particularly if they're already struggling because of disproportionate poverty, disproportionate access to resources that they need to care for themselves in their communities. Who's going to help take care of their children? Will I be able to get to all my appointments on time? Will the treatments be covered? And so there are a lot of worries that women have when they're coming from communities that have been disproportionately burdened by poverty, by discrimination, by other kinds of structural inequities that other communities have not had to deal with. For many communities, when they get a diagnosis, the question is, how quickly can I get started on my treatment? Let's beat this thing. For others, it's a whole other series of questions of, am I going to be able to survive life as I know it? Am I going to be able to take care of my kids? Who's going to pay for my house and mortgage or rent? How am I going to be able to keep my job and do all of these treatment things? And so there are very different approaches to cancer treatment, and wondering how that is going to impact someone's entire totality of being, that sometimes stand in the way of people getting care if diagnosed, or even seeking care in the first place. And so for me as a physician, and for other clinicians and oncologists and other people who would be a part of a support team caring for women, particularly women of color, we need to understand a holistic range of things that are affecting women when they're trying to make these decisions about what to do when they are coming in for screening, when they're getting diagnosed early in the phase, and how we can shorten that distance between diagnosis and treatment. It's not only about addressing the logistical factors or the health literacy factors, it's about supporting them in all the ways that we can to address their fears, their emotional concerns, how we can make sure that their lives are supported, that their families are supported, and they feel like they have the best chance to live a long and healthy life, one that is not going to be full of fear, where they will be loved and supported in the institutions where they're going to receive their care. They're going to be respected and cared for, and that we're all going to rally around them to do the very best that we can to provide them with the very best care that's possible. All of these things are things that we know as physicians are what we want. Our job is to make sure that the patients know that that's what we want as well. Thank you.